Good morning, everyone. This is Dr. Mohesh Raj Joshi, Doctor of Pharmacy graduate from Rajiv Gandhi University, Bangalore, Karnataka. Today I'm going to give a short paper ID presentation. Paper ID presentation SR206301132449. This was our topic: study on utilization pattern of corticosteroid dermatology unit in Jayanagar General Hospital for the period of 6 months. This was the introduction part. Skin diseases are a significant problem all over the world. It has been estimated that worldwide OPD-based consultation for skin-related disease account for up to 2% cases. The skin problems that are commonly found are acne, born scaries, hyperhidrosis, psoriasis, scabies, vertigo, pediculosis, herpes simplex infections, varicella, herpes zoster, erythema, urticaria, and so on. The pattern of skin diseases in India is influenced by the developing economy, level of literacy, social backgroundness, varied climate, and industrialization. Access to primary health care and different religious, racial, and cultural factors. Skin changes are affected with aging due to the passage of time, photoaging due to the exposure to the sun. What are the corticosteroids? So, corticosteroids are one of the most commonly prescribed drugs in the skin disease due to their anti-inflammatory and immunosuppressive action. They are widely prescribed in most of the departments in spite of their beneficial effects. They produce several adverse effects. Various adverse effects are seen with frequent and prolonged use of the corticosteroids, which include hypersensitivity, form eruptions, atrophy, telangiectasia, hypertrichosis, purpura, tachyphylaxis, etc. with topical steroids, corticosteroids, and hypertension, hyperglycemia, questionable immunosuppression, etc. with its systemic use. So it is also dangerous for the children as they are more vulnerable to topical corticosteroids because percutaneous absorption is more in children and may lead to systemic adverse effects. Corticosteroids have revolutionized the dermatology since the introduction of drug hydrocortisone in 1952 by Sulzer Witten. Methods and methodology. So study design, prospective observational study were conducted. Study location, Jayanagar General Hospital, Bangalore, for the period of 6 months. Source of data. Abstraction form we have collected. Study criteria, we have inclusion criteria and exclusion. Under inclusion criteria, all the patients visiting dermatology OPD of Jayanagar General Hospital and prescribed with at least one steroids above 10 years of age. And exclusion criteria, patients already on steroid therapy for indication other than dermatological. Study was conducted by collecting the cases from dermatology OPD containing steroids. Data was collected, documented, and self-designed data abstracted from and were analyzed to calculate the results. This was self-made data abstracted from we have collected 150 cases in this format. Results gender based upon gender distribution among 150 patients enrolled in the study. 89 were the females and 61 were the males. Based upon the age-wise distributions between the age group of 30 to 40 has to be found in 30 and more than 27, and lowest were between 70 to 80. Based upon uh, dermatological conditions, most were we have found the allergic content, that means 75%, and lowest were fixed drug eruptions, and we have found the second dermatitis 12%, further evaluation 11%, and eczema, psoriasis, lichen planus, so on 70%, 7%. Sorry. Percentage of steroids prescribed by generic and brand names, 72% were generic and 28% were brand names. By route of administrations, 90% were topical and 8% were parenteral. By formulation, 60% were ointments, 31% cream, and 9% lotions. Based upon prescribed steroid, most were clobetasol, mometasone, prednisolone, betamethasone, beclomethasone, desonide, halobetasol, dexamethasone, hydrocortisone, respectively. Based upon the potency, most were ultra high, moderate, high, and low, respectively. Previous history of steroids used: 66% only prescribed they were taking, 25%, 9%. This was discussion part. Among 150 prescriptions analyzed, the pattern of distribution based on the gender revealed that 89%, that were 59.33% were females, and 61 that were 40 0.67% were males prescribed with corticosteroid therapy. This data showed that female populations were more frequently prescribed with corticosteroid therapy. A study conducted by M. Kumar et al. Revealed that similar pattern of gender-based distribution. This was in contrast to a study by Zina et al., in which the male were more 56.6% and females were less 43.3%. The study showed that the number of the patients in the age group of 30 between the 30 to 40 years were more 40 than the age group than other age groups. Our results confirm with the study conducted by Mukherjee et al. Carried out in the year 2014 Eastern India. The second most number of the patients were in between 20 to 30 age group, which were 20%. The results revealed that two drugs were prescribed in 79 cases, followed by three drugs in 49 cases, single drugs in 10 cases, and in two cases and five cases were prescribed, which were similar to study by Mukherjee et al. Drugs in 51.82%, in 3 in 33.84, and single in 14.32. The study revealed that the steroids were prescribed more in generic name 120 than compared to brand names 46. That coincided with the study conducted by Nerukar RP et al., in which generic forms were prescribed in 80.66 and brand names in 19.33. Out of 160 corticosteroids prescribed in 150 prescriptions, most were prescribed from topical, followed by oral and parenteral. This is supported by conducted by Wane Parveen Kumar et al., where topical were most favored, followed by the oral and parenteral. Similar results were obtained in study by Dr. Puvali Roy et al. Our study was conducted only on outpatients, topical route becoming the preferred one. Based on formulation, highest was 60% this ointment, followed by cream 31% and lotions 9% respectively. This was contrasted studied by Nerupra Artvi et al., where creams was most commonly used formulations. Comparing the corticosteroid prescribed, most prescribed were clobetasol and mometasone. This is similar to analyzed by Purushottam K et al. A total of 149 topical prescriptions were prescribed. Among them, ultra-high potent steroids were prescribed the most, 60.84, followed by moderate potency, high, and low respectively. Conclusions. The study revealed that majority of the steroids prescribed were ultra-high potency. Among them, clobetasol alone or in combination with salicylic acid was the most commonly prescribed drug. Periodic study on the usage of steroids in the hospital setup should be encouraged, which will help the health care professional to select more appropriate medicines under the current conditions. Further, periodic utilization pattern analysis can contribute to formulary making and best utilization of the hospital budget. Involvement of the clinical pharmacy in patient care can help in the promoting drug safety and better service. Active monitoring of the medications adherence seemed necessary to optimize the benefits and reduce the potential risk of the adverse effect. Thank you all.